This meeting is being recorded by the Board of Health. If any other persons present are doing the same, you must notify the chairperson at this time. I will call the meeting to order at 10:01. Could we do a roll call?
Bruce Bennett here.
Kim Hilchey here.
Ryan Paxton here.
Megan Tudrin here. And Mike is on the phone. He'll unmute when he needs to.
Hey, Mike.
There will be, for public comment, no discussions or comments will be entertained unless requested upon by the chairperson of the board or the committee. Did anybody get a chance to look at the meeting minutes from last month's meeting?
I
Yes.
did not.
Okay. Do we want to, Ryan, were you able to?
I know you sent it to me. Let me just do a quick glance while you guys can keep going.
Okay. The meeting minutes from the previous month, I believe it was June, we can't find the recording for that one. So the city is still looking for it, but if not, I may need to just write up a blurb from my agenda about what we talked about. But the only part is I don't know who would have made like the motion to start the, to adjourn and things like that. So I don't know exactly what to do in a situation like that, but they're still trying to find it. But it was when our communications director had left and a new one had started shortly after that, but I don't know what happened during that time lapse.
Is Mary still working as a VHRC admin?
She is, but she is only on Mondays and Tuesdays for just a few hours right now. Something happened with her Social Security where they said you can't work above a certain amount of hours. And there was one time in like June and May where we had increased her hours. I don't know if you guys remember us doing that, but when we increased her hours, it put her over. So now she's only going to be able to do 10 hours with us until the end of January or December. And then in January, she'll be able to pick up the 19 again.
Okay, gotcha. I was just wondering because I noticed that like she wasn't preparing certain things or like not attending the meetings.
Yeah, it's only because we're just really, we only get her for 10 hours. So we try to have her do the
Yeah,
things.
understandable. Not a lot you can do
Sorry.
in 10 hours.
I know it's not.
Yeah, I get it.
Unfortunately, they sent her a letter after she did that, and she didn't know that that was going to be coming up. I just lost my agenda, but I know that the first thing on the agenda is going over what the nurses' activities were. Ann Mastrotataro, she put together a tick information corner in the on the lobby table in the Sunderland Town Hall, similar to the one in the Deerfield Town Hall. She set up a TikTok in September for Sanderson Place. She held a BP clinic at Sanderson Place in July. She has another one set for August 25th. Tonight she's doing a table at the South County Cruise Night with Cindy Mayeski. She has been partnering with the libraries in Deerfield and Sunderland. She and the American Red Cross. We're going to start a lending library where people can borrow blood pressure cuffs and things like that. They also are offering a station where you could just go in and put your arm in. We're going to see if the libraries want those. So she's been working with the three of them. Sunderland has an appointment set up. Deerfield, they would like to wait until they move into the new library, which is totally reasonable. She's been working with maternal child visiting programs. She has been attending meetings with Ann Mistavar and a few others, trying to revise a flyer that she should be able to distribute shortly. But as she was doing that, Sarah also came up with a flyer, meeting with all of the same people. We didn't realize that they were double doing it. So Sarah's flyer should be ready any day, and we should be sending that out and this is so that we can start new mom and baby visits. So if somebody delivers within the first 6 to 12 weeks, we should be able to go out and visit their home, check the baby's weight, talk to mom about any concerns she might have, postpartum depression checks, things like that. We'll give them a new baby bag. It seems like a really great program. It is one of the requirements for Safe 2.0 is to um, do new parent outreach. We're working on setting up flu clinics. In Deerfield, we are looking at possibly September 30th. We have to check with the fire chief and see if that would work for him. Um, and that would be 11 to 2 if we do that. Robin has some flu clinics already set up in September. I believe it's the 25th is her first one, and October 3rd. And that is with Walgreens. Sorry, I'm gonna run into Robin stuff too. She has the WOW bus coming in October that will also offer vaccines. And they'll offer more than just COVID and flu for the WOW bus. I'm not quite sure about Walgreens, but I'm sure if somebody needs it, they would bring it with them. We have one in Greenfield set up at our senior center, and they're bringing shingles and RSV as well as flu and COVID. And that's September 26th for Greenfield. Shutesbury is likely going to have Stop and Shop go there to do a clinic, but we have to wait until the school nurse comes back from summer vacation so we can set that up with her. What else? Let's see. Robin's continued to distribute tick information. She's called the newspaper and asked them to run an article, which they haven't done yet, but she gave them all of the information if they do decide they're ready for it. She's reviving her safe gun storage and marijuana edibles because there's been an increase in pediatric visits for ingestion of those products. She's been partnering with Greenfield Savings Bank. She has a suicide myths course planned for October 4th at the bank. She's hoping to give out firearm cable locks to distribute from the VA in Leeds. She's gone to various online programs about vaccination, firearm safety, and ticks. She also started a blood pressure cuff lending program in Turner's Falls that will be up and running soon at the library. And she's been helping me in Greenfield with reaching out to our library and getting that program set up in Greenfield as well. See, she's also going to put a blood pressure station in the Greenfield Savings Bank. She just contacted American Heart Association and put the two of them in contact so that they can get that started. And she just wanted us to note that she has an amazing community collaboration with the library, Greenfield Savings Bank, Walgreens, and the FERCog. So she just wanted to do a little shout out for that. Let's see. The last one is Sarah. She did page. Sarah has already started doing the mom and baby visits. She has one scheduled, I believe, this week. She did the flyer, the brochure. She met with Ann Mistover to make sure that everything looks good on their end. She came up with a procedure checklist so that we're all going to be doing things the same way. So we're all going to be checking weights, or we're all going to be doing a postpartum depression screen, things like that. And that should be ready to distribute to the rest of us shortly. She created a shared Google Drive for all the nurses so that we don't come up with that problem that we had with Anne, where we were both working on the same flyer. So now when we're doing something, it'll go in that Google Drive and we will all have access to it. She created and distributed tick illness fact sheets due to the elevated tick-borne diseases in our area. Leverett and Shutesbury are super, super high. She gets several cases a day. So she's really honing in on that one. She has
Are those actual cases or ticks that tested positive?
No, these are actually humans that tested positive.
Thank you.
She does do in-person client visits for elderly and at-risk folks. Those are done on Tuesdays and Fridays. She met with the Council of Aging administrative personnel, and she met with a librarian to schedule upcoming educational sessions for the blood pressure clinics, because she has those in Leverett and Shutesbury as well. And I think that is about it for the nurses. Let me just pull up the agenda really fast so that I can see what is next. I know that on the agenda is that we hired a new part-time inspector who will be starting in September. Her name is Anne. Right now, she is in Washington, DC. She'll be coming back in September, and that's when she's hoping to start. She has a science degree in chemistry. She has worked in hazmat, lots of solar projects, things like that. She does have a pretty good environmental background, but no, she doesn't have any of the required courses that we need, like the Title V, soil evaluator, any of those type of things. So hopefully we can get her trained up really quick. We'll start off with food because Corey just got into the tier 2 housing course for October. So he should be ready to move on from food, start doing housing, and then can really start taking on some of those cases. And food is fast. She'll be able to be up and ready to go in like 2 weeks once she starts with food. Sorry, it's just taking me a second because I'm talking and trying to look it up at the same time. Let me just go to calendar. And that was another thing on my list. So, Corey also got into the soil evaluators class, which I don't know how he did. It was a miracle because usually you have to be on the wait list for a year to 2 years to get into that course, but he is in and he starts next week. So he'll be able to do perk tests. He won't be able to do Title V's yet, but he will be able to do perk tests when the class is over. And it's an 8-day class, but it's kind of spread out. So I would say by November 1st, he'd be up and ready to do the perk tests. Just checking to make sure. We have a subject matter expert who was assigned by the DPH. Her name is Robin Chappelle, and she is currently looking at Leverett's Title V regulations to see if there's something that you might want to change in there. And then if so, would we all want to adopt the same policies? Are we all going to go back to the state? Things like that. So she's going to weigh in on her opinion. We were going to hire as a contractor to look at all of our regulations, but the DPH has offered this to us free of charge for the grant. They're still paying her as a subject matter expert, but they're not charging us, which is kind of a bonus. I also gave her some.
Will she be in contact with us or Steve in particular?
Yes, after she looks at them, then she will definitely either go to a meeting of yours or whatever you guys need. She'll make the plans for that.
Okay.
We should plan some discussion around like just what we're thinking in terms of the group, if there's a hope that it's going to be adopted elsewhere. Because like Montague has 0 local Title V regulations and never has. So I think we'd have to do some strategizing probably if we want to have a shared vision of that.
Do you think that you want some additional regulations?
Me personally, no, but I mean,
Yeah, okay.
my board might though. Not sure.
Yeah.
I haven't talked to them about it before, so.
Okay, I think our board is thinking no additional regulations.
Right now we don't.
I would think in Sunderland, we're thinking of keep what we have.
And do you have no additional regulations or do you have some special things?
I don't think we have additional ones. I'll look and see.
Okay.
But I don't think we do.
Okay.
The big thing for us is that witnessing Title V inspections would require essentially like a whole nother, well, I guess it wouldn't need to be a full-time job, but we don't have the capacity to do that now. So it'd either have to be something that we would work out capacity in VHRC, or we'd have to consider like hiring a part-time inspector.
Yeah. Or John, I'm sorry. John, do you know why you originally went to the additional regulations? Was there something that triggered that?
I don't know exactly. I've been on the board for many, many years, and there were regs. I do know that there was always some concern about mounted systems. I know that we do require a witness for Title V because we weren't always satisfied with, we didn't trust everybody all the time.
Okay.
We also, I know we were concerned about direction of flow towards receptors, so we wanted to restrict some of that. I'm doing this all off the top of my head.
I know, sorry.
No, that's fine.
And admittedly, Leverett has some more sensitive, I would say, hydrogeology than maybe Montague does.
Yeah, I know Mike
Yeah.
was saying that the perk tests can sometimes take quite a while.
Right, right, right. And I one of the big controversy things with us was at what would be allowable seasonal high water table. And we do restrict it to no more than 2 feet. Anything above 2 feet, we don't allow.
Okay. Okay. All right, that's good to know. I will help pass that on. Um, I also gave I know Ryan, you guys do green burials, or at least you have a green burial cemetery because I just ran into it this weekend. Do you allow green burials on private property in your town?
Yeah, so we kind of have to, because we don't have a regulation prohibiting it. As far as process for approving it goes, we just follow the recommended guidance that's provided by DEP.
Okay.
Um, what I should say is that we've considered approving them for separate properties, and no one's ever actually gone through all of the steps to get one approved from us.
Okay.
But I can drop the DEP guidance in the chat just so you can all have it. I think it's pretty straightforward. If it became something where we were having, green burial sites being approved all around town, I would probably take that to my board and be like, we need to, regulate this further. But like I said, it's more so that people are interested in it. And then once we kind of tell them what's required for it, not a lot of people have gotten through it. Because like one thing you have to do is you have to do like a soil evaluation, if you're following the guidance, and then you have to get a plan drawn, and it ends up being kind of, something that people have to pay probably a few $1,000s for because they're working with a designer of some kind. And I think a lot of people think it's more just along the lines of like, I'm just going to ask the Board of Health for permission to be buried on my property. And the other thing is that it's required to go on the deed. So that kind of prohibits a lot of people from doing it because a lot of people realize that that's going to impact the sell value of their house. But
Yeah.
yeah, they're doing some trainings on it from time to time through MHOA and things like that. I definitely recommend seeking out some of those resources because it'll probably become more common, not less common over time. And yeah, we followed this process for approving one of our cemeteries to accept green burials. And I was only here towards the tail end of it, so I'll be honest, I don't think we followed the process the way that we would now.
Yeah.
But it's a huge plot of land that's got tons and tons of sand, so it seems to be working out okay.
I did come up with some basic draft regulation type things for a green burial, and I came up with an application. And the application, I stole a lot of information from the FERCog too, but it really has all of the things like you were just saying, like a checkoff sheet, like do you have a soil evaluation? Do you have this? Have you gone and gotten the parcel number and things like that? So I think that would be helpful to share with the group too, but I wanted to send it down to Robin first so that she could take a look, the subject matter expert. Because I think that her input would also be great to make sure that I'm not missing anything. But I think once people see that permit, they're like, oh, maybe not. But I just learned a ton of new things this weekend because we had somebody that was going to pass who was going to go to the Montague Green Burial Cemetery. But I didn't realize things like we're required to give a transport permit if they don't work with a funeral home, that there's ways that we have to make sure that they're caring for the body with ice and things like that at home, and they have to be buried within 50 hours. But sometimes the cemeteries can't get somebody to dig a hole until a Monday if it happens on a Friday and things like that. So I wanted to kind of put all of those things in so that we can hand that packet to somebody when they're interested, because there's probably a lot of things that they're not thinking about when they're discussing that with their families.
Yeah, even without regulations, I think a packet like that would be really helpful.
I
Yeah.
think so too.
Yeah,
Yeah.
we get questions every once in a while. People are interested.
Okay, great.
That'd
So
be
I
helpful.
will I'll send out what I have now, and then as Robin adjusts it, I'll send it out.
I think we had an inquiry a couple of years ago, but it didn't go anyplace. But
Yeah.
it'd be interesting. It'd be nice to have some regulations or at least knowledge of it.
Yeah, it is. It's a lot to learn. That's for sure. I took a class and I thought I was fine, but I just learned thousands of new things over the weekend because we got urgent calls on Friday.
Yeah, well, Deerfield's experience with a buried horse on somebody's property is probably indicative of why it would be good to have regulations in place. Because if a horse is going to cause that problem, what about your neighbor?
Absolutely, Tim. Um, an update on open food and housing cases. Corey has pretty much done everything in Sunderland. He has done everything in Greenfield. He's helped out a little bit in Montague. He has plans to go to the Shutesbury Athletic Club or something like that. It's a restaurant or something, but it's called Athletic Club.
Bar, it's a bar.
Okay, whatever it is.
Well,
I know he's going there next
Lifting
week.
your drink.
there's a kitchen there. They have events, they serve food, all that stuff.
And John, he was asking, do you want him to go do the the co-op store?
No, Steve does. Steve is
can do all
back.
that.
Yeah, we do
Okay.
all that stuff, yeah.
Oh, that reminds me, Bruce, Steve is back for John. Is he back for you too?
No, I'll get a hold of him.
Okay.
I'll get a hold of him next week and talk to him.
Okay, sounds good. Mike, you want to talk about COCs?
Sure. So I'm not doing live right now because Steve's back. Shutesbury is gonna apparently do their own. And Bruce, you said you're fine with me just doing them.
Yes,
Okay, so I'll just keep it like that. I have been asking the people, Bruce, if they've paid. I kind of reassessed that. I stopped yesterday to see if somebody's check came through. It didn't come through yet, but as we know, the post office has had its problems lately, so things don't come as fast as they used to. So I'm sure it's on its way, but I do tell people again when I go, like, make sure you paid this, make sure it's going to the Sunderland Board of Health.
and that's for what? And that's for what, Mike?
I said that seems to be the way. I just reaffirm that they need to be sending the money to the Board of Health. And most of them say, yeah, they've either sent it already or they'll make sure it gets there.
And that's for a septic inspection or?
Yeah, just
Same
septic
review.
stuff.
Yeah, okay, yep.
Yeah, other than that, it's been fine. Haven't had any issues with anyone. They've all been fine. It's been pretty busy up in Leverett and Shutesbury lately. It looks like it's starting to slow down now. Sunderland, I've had some here and there, but it hasn't been too bad. Other than that, yeah, it's been going fine.
And I think that is all I had for new business. Did we want to? Okay, I saw in a chat about I spelled Joe Comerford's name wrong in July 31.
Minor typos.
Yeah, perfect. I'm gonna take a picture so I can screenshot it, or I don't have screenshots, so I'm gonna just take a picture. I will make those adjustments. Does anybody want to make a motion to accept the minutes with the changes in Joe Comerford's last name, a space between Meg Tudrin and I'm missing an
L.
an L in Tim Hilsey.
I debated putting it capital L, but
Yeah, no, that's okay.
so moved.
Second,
Okay, so Tim, second by Bruce. All in favor?
aye. Bruce Bennett,
Kelsey,
aye.
aye.
Tim, Ryan.
I'm gonna abstain.
Okay,
Just 'cause I didn't look at it.
That's okay.
But I did go on, watch the recording.
you did.
I did.
Great.
Good. I'm glad that happened.
Yeah, we have a new communications director, and he's going to try to make sure that everything gets posted.
No, it's great.
So people can see
No,
it.
it's great.
Anything else that I'm missing? All right, we'll set a time for the next meeting. See, we are going into September, and we usually do the 9th. Let me just see on my calendar if that would be the second. Oop. Nope, that's October. Let's not skip September. Actually, well, I was gonna say we could skip September because it's so close, but maybe not. September 11th, is there anybody that can't do it on September 11th at 8:30 a.m.?
These are Thursdays.
Yes.
Yeah, I may be able to do it for just well, maybe. I may have to leave by 9 o'clock, but
We should be done by 9. Like today's meeting was only 26 minutes,
Yeah,
hopefully.
okay,
So
all right.
Is anyone going to the Yankee conference that's that day? I'm not going, but just curious. Cool. Okay. Well, that's during the Yankee conference, so I just thought. Yeah, another thing I wanted to mention, just sorry, I should have brought this up when you asked if there's new business. Is the group aware of the proposed legislation to restrict some of the use of wood burning as a green energy in Massachusetts?
no.
No,
Okay, so currently wood burning is allowed basically as a green energy, which is unfortunate because our area's got a pretty significant pediatric asthma incidence rate, and we typically have pretty high occurrence of particulate matter, as you might know from the air sensors, things like that. So right now there's some proposed legislation. It's like a two-part bill, one from the Senate, one from the House, that would kind of restrict that as part of green energy. And I think it's particularly relevant for our region just because there is a proposed wood burning power plant that has been talked about on and off in the Springfield area. And this would be something that would kind of, permanently prevent that from being considered, green energy. But if I can find the bill really quickly now, I will drop it in the chat just so you guys can take a look yourself.
but is this, well, I'll let you look.
Industrial scale burning is industrial scale burning. So I could certainly get behind that, particularly since these things are sited in poorer neighborhoods, et cetera. Individually burning of trees is going to be hard to regulate and hard to stop. I suspect the intent is to, I think Atlas Farm Store, or the Atlas Farm itself started, using the green energy to burn, to heat their high tunnels. And, they're organic, but they're, so it's like, that's my take anyway.
And I don't know as though we necessarily need to like make a VHRC like stance on it or anything like that, but I
Right.
wanted to bring it to all your attention in case you guys felt strongly about it.
But is this for industrial? Is this for residential? Is this for outdoor wood fire boilers? I mean, what are we talking about?
Well, I'd encourage you to read the full text, but it refers to essentially biomass facilities is what it's referring to.
Yeah.
It's not covering like, like a home using wood burning, like a wood stove or something like that. Because, obviously that would be kind of an equity issue.
Well, no, there's that whole thing about outdoor wood boilers for a while.
Oh, right. You're right. I'm sorry. I forgot about that. But no, this is for biomass plants.
Okay.
Ryan, can you send out a, what the citation is on that legislation proposal via email or something?
Yeah, I can send you an email, Bruce.
Okay, thank you.
You're welcome.
Hey, anything else?
I want to thank Megan for you did a Title V for us.
Yeah.
So
It's in my
appreciate
backyard.
hopefully everyone was friendly.
Oh yeah, great. It was hard to find though. Took us a
Oh
little.
yeah.
All right. Do we have a motion to adjourn?
So moved.
Second.
And that second came from Tim? Is that okay? Second. All in favor?
Bruce Bennett, aye.
Tim Hilchey, aye.
John Hillman, aye.
Okay, motion adjourned. We'll see you guys next month.
Take care, everyone.
Aye.
Thank you. Meg, can I call you?
Yeah, absolutely. I'm just gonna try to figure out how to end the recording. There we go. Okay, yeah, give me a call now.
Okay.